Welcome to the Experience Better video podcast series. I'm Josh Beekler, and with me today is Noelle Bailey. She's a speech-language pathologist here at the Balanced Mobility in Hastings and Children's Rehab Center. And today we're going to talk about communication, both for kids and adults. So obviously communication, being able to communicate, get our needs across is a really critical thing. So when somebody can't do that in a traditional method of being able to talk, what are the options out there?
So there's something called alternative and augmentative communication, otherwise known as AAC, or a speech generating device that can help kids and adults who may be nonverbal, have a diagnosis of autism, ALS, and other diagnoses that may prevent them from communicating like we do. So if they do, sometimes we kind of talk about getting them a device that can help communicate their most basic wants and needs. With kids, it can help with homework at school, doing their spelling words, saying I need to go to the bathroom, as well as with adults. So we have a couple of options that we kind of look into when we are working with representatives from different companies that offer these kind of devices. We have some that are just a little bit smaller, kind of handheld like an iPad. Then we've got another one that can be a little bit bigger. And you can also have a key guard for children who have issues with their movement of their hands or, lack the mobility that they need to access a device. We can also use another device that helps people who cannot communicate verbally with their eyes. So they use their eyes to track the device and comment on what they need and want. We see that a lot with Rett syndrome or ALS. This would be a good option. So there's more options than this available. This is what I have at the clinic to kind of trial. So if you need help with communicating or want to look into doing a device, we kind of do a trial through a couple of months. Contact a representative to come down with us and do an evaluation to see if insurance will cover it or if they're appropriate for a communication device.
And what the best device is for them. So that's
Yes.
great. So what I notice is there's a lot of different options as far as ways to communicate, and things I've seen in the past are things like that where there's a picture or very common phrases, but you can even do like texting essentially. There's even like texting type functions.
I actually just worked with a patient who had a severe stroke, and one of her goals were to keep texting with her daughters. And that was something we kind of worked on. Was I would have my iPhone and she would have hers, and we would text the conversation back and forth, as well as still communicating verbally, just because I don't want her to lose that as well. But she really enjoyed the texting aspect, because that is something that we do it every day.
Right.
And that's just our technology in this day and age is the phone.
Absolutely.
So
very cool. So it's communication is probably something that we definitely underappreciate until you lose it.
Yes.
Kind of a thing. I mean, it's nothing is more frustrating than not being able to communicate your wants and needs, and it's great to have tools like this and experts like this who can help you get into the right type of device. And you mentioned they can be handheld, they can be wheelchair mounted, they can be just about any adaptive situation you need. So.
Yep.
Very good. Well, definitely come down and see Noelle if you have any needs like that, or have a loved one who you think may. And we will see you next time on the Experience Better video podcast series. Thank you.
Thanks.